So the last few years we've seen a rise in consumerism and transparency in healthcare, really a more patient-empowered healthcare model. To support that, the CMS, the federal government, has created a hospital compare website which ranks hospitals using a star system, 1 to 5 stars. It's very similar to what you'd see with a restaurant or a movie or a book, something like that. And this has created a lot of concerns in the hospital industry, primarily because it is based on a very small data set. Now that data set will increase, these patient satisfaction scores that are going into it will increase as time goes by. But right now it's on a very small data set, and that has resulted in a lot of the really name brand top echelon hospitals actually being ranked a lot lower than expected. So there's things that hospitals and health systems should do at this point. One is to understand what goes into these scores and how they can improve them, of course, and also how you can improve and focus on the scores now that will be included in the future. The other is this hospital compare website is not the only thing out there. There's also, let's say, less scrutable sources out there that are ranking hospitals using proprietary models. So we're encouraging hospitals to research and see where their facilities are showing up in a Google search or anywhere on the web and really get ahead of that conversation. Also, a hospital should try to benchmark themselves against their peers. If their peer hospitals are significantly ahead of them, especially, or behind them, they really need to craft that conversation, get in front of it, and talk to their patient population, help them understand, because the average patient is not really going to understand the difference between a hospital compare website, which is the federal government, and these other proprietary models which don't necessarily have the best interest of the patient or the hospital at heart. So this is a time of really transformational change in the industry, and everybody's just trying to do the best they can to keep up. What we would encourage our hospital clients and partners is to reach out and to grasp the resources you have available to you. Advisors, consultants, anybody that has this kind of expertise, including CRI, reach out to us and let us help you through this time of change.